Hi, my name is Evelyn Jimenez, and I am a physician assistant student here at UTRGV. Today, I will be presenting Bridging the Digital Literacy Gap, Physician Assistant Students Teach Technology, or PAST for short. The PAST project was done in collaboration with Dr. Paul Ye and Professor Christina Gonzales, who are both instructors in the PA program at UTRGV. Our project was possible thanks to the generous financial support from the PA Foundation. Before beginning, I'd like to provide a brief background as to why we decided to implement this intervention. So COVID-19 created a huge unprecedented shift from in-person care to telehealth in a very rapid amount of time in order to minimize the spread of COVID-19. Unfortunately, this impacted access to and quality of healthcare amongst populations who just didn't have the digital literacy skills. It eventually ended up exacerbating existing health disparities in already minoritized and marginalized communities. Low digital literate patients, which make up most of the population within our clinics in the RGV, faced higher levels of non-attendance of virtual visits, loss of follow-up, and if they were able to attend the telehealth consult, they had issues with comprehending the provider and relaying health information during the visit. The purpose of this study was to address those barriers throughout the pandemic. Our primary goal was to assess the impact of a community-based interdisciplinary educational intervention that was culturally sensitive in order to bridge the digital literacy gap in local Hispanic adults. Our hypothesis was that by implementing this intervention, we would increase the knowledge, confidence, and willingness in using digital technology for health-related purposes. Ultimately, to ultimately empower our participants to have higher quality of healthcare throughout their telehealth encounters. Through extensive community outreach, we were able to gather a cohort of 10 patients within our clinics. Participants were then invited to attend an 8-week educational session that focused on basic use of technology and how to access telehealth platforms and how to properly use these telehealth platforms. The primary outcomes were measured via a self-administered paper survey that was given to participants at the beginning of the first session and at the end of the last session after the intervention. Given the small sample size of 10 participants and the non-normal distribution of the variables, we used non-parametric Wilkinson-Cox match pair sign rank test and chi-square tests to evaluate pre-post changes in mean values and proportion respectively. Our participant demographics indicated that the mean age was 49.6 with a range from 40 years of age to 61 years of age. 70% of them were female. 100% of them were Hispanic, with 90% of them indicating that they were foreign born, and 100% of our participants indicated that they were fluent in Spanish. Only one participant indicated that they were comfortable receiving health information and the intervention in both English and Spanish. Baseline characteristics indicated that all of our participants, 100% of them, currently use a smart device, but only 40% of them had used telehealth prior to the program. Also, 80% of our participants indicated that although they used a smart device, they heavily relied on a family member to access the internet via that smart device. We measured our primary outcomes on a 5-point Likert scale, where 0 was not at all comfortable, 2 was moderately comfortable, and 4 was absolutely or very comfortable. Our results indicated that there was a statistically significant increase by post-intervention compared to baseline in the mean comfort level of using a smart device to perform video calls, send and receive emails, and access the internet. There were also significant increases compared to baseline in the mean stated comfort level of navigating health information with their smart device, in using health platforms like a patient portal to review their personal health information and communicate with the provider, and also in measuring their own vital signs and reporting them via telehealth platforms. Lastly, I'd like to mention that we also saw a 50% reduction in the proportion of our participants who indicated that they needed a family member to assist them to use their smartphone to access the internet, from that 80% down to 40%. Although the sample size was smaller than anticipated, we managed to get 10 local and highly engaged adults who derived a benefit from the educational intervention. As this was a pilot study of our developed digital technology educational program, we intend on using these results to guide future program enhancements. We also plan to disseminate this program to a broader population of local adults in the RGV who lack digital literacy in order to empower them with a comfort and willingness to utilize digital technology to access their healthcare services. We look forward to your feedback and enhancing our intervention in the future. Thank you for your time.